the patient's chart in order to ensure that this procedure is ordered by the physician, and read the medication ticket for all the topical medication for first reading.
Patient JLP room 123. Date October 24, 2020. Dr. Esplanada. Wound dressing today. Nurse ACT CDUCN SN. Patient JLP room 123. Date October 24, 2020. Dr. Esplanada. Elastoplast ointment topical as needed. Nurse ACT CDUCN SN. Patient JLP room 123. Date October 24, 2020. Dr. Esplanada. Bacitracin zinc sodo cream topical as needed. Nurse ACT CDUCN SN. Patient JLP room 123. Date October 24, 2020. Dr. Esplanada. Povidone iodine powder 5%. Betadine powder topical as needed. Nurse ACT CDUCN SN. Patient JLP room 123. Date October 24, 2020. Dr. Esplanada. Chlorhexidine diclocomate Hyclins spray topical as needed. Nurse ACT CDUCN SN. So, good day sir. I am Ann-Karin Pitumulak, your student nurse for today. So, sir, can you please state your name and your birth date?
My name is Jean-Luc Palman and my birth date is August 21, 2000.
Okay, sir.
Explain the procedure to the patient to reduce anxiety and so that the patient will know about the process that will be done to him or her.
I will be performing the wound dressing, so it is to protect the wound from microbial contamination.
And explain topical application. It is to deliver medication directly onto the areas of the skin that are irritated, inflamed, itching, or infected. Then gather the necessary materials needed for wound dressing and topical application. Perform medical hand washing to prevent from cross contamination. Bring the tray with all the materials to the patient's bedside. Open the materials in the patient's bedside and place the following sterile materials on the open dressing set using the pick-up forceps. 1 medicine cup, 10 pieces, tongue depressor, 2 cotton pledgets, and lastly, 1 kidney basin. Open betadine solution and PNSS bottles. Pour out a small amount of each solution from the respective bottles. And take note that first pouring should be discarded in a biohazard or plastic bag.
So, mag-start na ko sir ha sa imong removal sa imong dressing. So, ako ning ano siya ha, open sir. Okay lang mo sir.
Place the curity pad underneath the patient's affected area and drape if necessary. slowly remove the soiled dressing with the dressing forceps. If the gauze adheres to the wound, loosen the gauze by moistening it with sterile normal saline solution by using the cotton balls. Get the pick up forceps in the dressing set with the left hand and pick up the cotton balls in the kidney basin and gently dip into the PNSS to cleanse the wound. Do this thrice. With your right hand, get the dressing forceps in the dressing set. If the cotton ball is too wet, squeeze out the excess solution by twisting between the dressing forceps and pick up forceps. Apply the betadine solution thrice by dressing the area from inner to outer if wound is circular, and then discard the cotton balls in the waste receptacle. For vertical wound, follow the same steps in picking up the cotton balls. Apply the PNSS to cleanse the wound thrice by cleaning the area from top to bottom. Apply the betadine solution thrice by dressing the area from top to bottom, and then discard the cotton balls in the waste receptacle. Horizontal wound, follow the same steps in picking up the cotton balls. Apply the PNSS to cleanse the wound thrice by cleaning the area from side to side in one stroke. Then apply the betadine solution thrice by dressing the area from side to side in one stroke, and discard the cotton balls in the waste receptacle.
Patient JLP, room 123, date October 24, 2020. Dr. Esplanada, Elastoplast, ointment, topical, as needed. Nurse ACT CDUCNSN. Patient JLP, room 123, date October 24, 2020. Dr. Esplanada, Elastoplast, ointment, topical, as needed. Nurse ACT CDUCNSN.
Gather the necessary materials for applying the ointment. First thing to do is to use Kelly curve to clean the wound debris if necessary. When you're cleaning circular wound, it must be inner to outer. And do this 3 times. And don't forget to discard the cotton balls in the waste receptacle. For vertical wound, you have to clean it from top to bottom, and do this 3 times. And don't forget to discard the cotton balls in the waste receptacle. For horizontal wound, you have to clean the wound from side to side in one stroke. Do this 3 times, and don't forget to discard the cotton balls in the waste receptacle. And then, do open gloving using clean gloves. Open the ointment using the pinky finger. Discard a small amount of ointment using a cotton pledget. Place the ointment on another cotton pledget and apply it inner to outer if wound is circular. For vertical wound, apply it from top to bottom. For horizontal wound, apply it from side to side in one stroke.
JLP, Room 123, date October 24, 2020. Dr. Esplanada, Bacitracin Zinc, Sodo Cream Topical, as needed. Nurse, ACT CDUCN SN. Patient, JLP, Room 123, date October 24, 2020. Dr. Esplanada, Bacitracin Zinc, Sodo Cream Topical, as needed. Nurse, ACT CDUCN SN.
Then gather the necessary materials for applying the cream. Do open gloving using clean gloves. Open the cream and pick up the tongue depressor and place a small amount of cream on it. Then apply the cream over the wound area using the other side of the tongue depressor. Gently spread the cream on the wound area. Use another tongue depressor to get more cream from the tube if necessary. And don't forget to discard the tongue depressor in the waste receptacle.
Patient, JLP, Room 123, date October 24, 2020. Dr. Esplanada, Povidone iodine powder 5%, betadine powder topical as needed. Nurse, ACT CDUCN SN. Patient, JLP, Room 123, date October 24, 2020. Dr. Esplanada, Povidone iodine powder 5%, betadine powder topical as needed. Nurse, ACT CDUCN SN.
And gather the necessary materials for applying the powder. Do open gloving using clean gloves. Open the powder and gently tap the powder directly over the wound. With the use of tongue depressor, gently spread the powder over the wound. Use your gloved hand in getting the tongue depressor, and don't forget to discard the tongue depressor in the waste receptacle.
JLP, Room 123, date October 24, 2020. Dr. Esplanada, Chlorhexidine diclocomate, Hyclins spray topical as needed. Nurse, ACT CDUCN SN. Patient, JLP, Room 123, date October 24, 2020. Dr. Esplanada, Chlorhexidine diclocomate, Hyclins spray topical as needed. Nurse, ACT CDUCN SN.
Gather the necessary materials for the spray. Do open gloving using clean gloves. Get the spray and position the nozzle 2 to 3 inches away from the wound, and let the patient turn his head away. And then, pick up the gauze with a pick-up forceps and gently place it over the wound area and secure it with a plaster.
Thank you for cooperating, sir. So, that's all.
And lastly, do aftercare. Discard all the materials in their designated trash bins.